Good morning everybody, my name is Jack and this is my channel. I'm going to be doing a video blog, video diary about my experience in nursing school here in Australia. Let's start with the different level of nursing in Australia. Two levels of regulated nurses in Australia, so you've got an enrolled nurse and a registered nurse. Currently I'm training to be an enrolled nurse and then I'll be going to university after I finish. Okay, sorry about that everyone. I just needed to change the environment a little bit because I've got my phone sitting on a pillow, so yeah. So currently I'm doing a diploma of nursing through an institution called TAFE, which is a college, so my course is about $14,000 and it is government funded until we reach a certain point in our income. From there, I intend to go to university to complete my Bachelor of Nursing, which will then give me the title of being an RN. So the EN, enrolled nurse, and the RN, the registered nurse, scope of practice is relatively similar, but the EN does report to the RN. A lot of the times the EN will need to work by themselves and are responsible for their own actions, and they are registered as well, so the enrolled nurse does have a registration with the Nursing and Midwifery Board of Australia, as does the RN. So that's different to a lot of other places where you've only got, your registered nurse and then your nursing assistant. So your enrolled nurse here in Australia is still a regulated nurse and are still responsible for their own actions. Their scope of practice is just relatively different. So that's me. So I just wanted to touch on today, I have been doing my course for about 6 months and we've just done a clinical rotation. Well, it's not really a rotation, it's more of a skills training week. Basically, we have a clinicals week where we go to the college for a week and we get trained the practical skills to what we've been learning to the theory. So the one that I've just done recently in my last video, if you saw that, was just basic vital signs and that kind of thing. So we had to do a written assessment which was 20 minutes long, and our patient had suffered a CVA, so a stroke. We had to just identify some terms associated with a CVA and the normal ranges within the vital signs. So we had to complete a pain assessment on the patient. We had to measure their pulse, oxygen saturation, their blood glucose, the respiratory rate. We had to identify hand washing and use of PPE, waste disposal, cleaning, surface cleaning, blood pressure, all of those vital signs and assessment tools. So our patient, it's basically like it's called an OSCE, or an OSCE, O-S-C-E, and it's a simulated thing where the teacher is acting as the patient and we have to go in and complete an assessment on them, or whatever the task is. So they give us a case study. My case study was that the patient had suffered a CVA and they had a left-sided hemiplegia, so that they were paralysed on one side. They were hypertensive, hypoglycemic, there was lots of other things. So when I arrived in to complete my assessment, my practical assessment, my teacher was hanging off the bed, screaming. So I had to help them back onto the bed, so that was crazy. And they had just fallen off the bed basically, so I had to complete a pain assessment, document it appropriately. I passed, thank goodness for that. So I did pass my written and practical assessments. Unfortunately for me, I couldn't find the teacher's blood pressure. So I was trying to locate the brachial artery and then auscultate with my stethoscope and listen to the teacher's blood pressure. So I tried 4 times and I got it on the 4th time. So in that environment, they use a double jacked stethoscope. So you've got this part here and it's connected here so that the teacher can listen and actually see that your measurement is accurate. So that was really hard to hear. I could not hear it at all. The teacher even advised me to try it on the other arm, so it was just a disaster. And in that moment you're panicking, so I was just stressed. I didn't know how to move on. She said, okay, just move on to the next thing. So it's all good. I passed in the end. She just suggested that I keep practicing blood pressure, even though the day before we had been practicing and I was fine. I did a great job. So anyway, you can blame the stethoscope. I don't know what it was about. So I passed that, so that's good. And the next one is in May 2019, and then following that we have our first placement. So that is 3 weeks in an aged care facility. So that will be exciting. So we're actually in an environment where we have to care for patients and put into practice everything that we've learned doing theory. So we do 1 week clinical skills before we go out on placement, so get assessed on that, and if we don't pass that, then we don't go out on placement. So yeah, so this is just a video diary to update that. So I'm going to be posting some more vlogs and stuff next year when I go on clinical placement, and just basically keep a little video diary and a day in the life kind of thing, because I know that the nursing education is a lot different here than what it is over in America. I watch a lot of American nursing vlogs and I love watching them. I watch them all the time. But it's very different. So when, there's a lot of people referring to clinicals. Our clinicals is in a simulated environment. American clinicals is actually in a hospital or healthcare environment. We call that prac. So when we go out on prac, that's when we're going out in the hospital simulation. So hospital environment. So anyway, just an insight. If any Australian nursing students watch this video, then I hope this helps you if you're interested in getting into nursing. So if you like this video, make sure you leave a comment down below and let me know what you'd like to see or ask any questions. I'm happy to answer anything. So 6 months in, I've got 1.5 years to go left of my diploma of nursing, and then from there I'm going to go into university. So thanks for watching. If you like this video, subscribe and leave me a comment.